Okay. All right, everyone. So we are the M.E.N.D Initiative. Rithika's gonna tell you guys a little bit about us.
Okay, so basically, we're the M.E.N.D Initiative, a mission to increase awareness on non-communicable diseases. And we're doing this as a part of a competition for HOSA, where we're basically increasing awareness in the community for a cause, which is like raising awareness about the inequity in non-communicable diseases in impoverished people.
All right.
Yep. So to give a brief overview of what we're going to be covering throughout this presentation, we will be going over the definition and examples of some non-communicable diseases, or known as NCDs, the statistics and risk factors that lead up to NCDs, how to diagnose these factors and how to treat them, and then we'll end with time for questions.
So what are NCDs? NCDs, also known as non-communicable diseases, are conditions that are not caused by an acute infection, meaning like a cold or like the flu or something that go away and can be cured, and they result in long-term or chronic health consequences. And non-communicable diseases kill around 41 million people a year, which is equivalent to 74% of deaths globally. You may have heard of some non-communicable diseases like cancer, cardiovascular disease, diabetes, and chronic lung illnesses.
Yep. And NCDs are obviously international, but if we want to go into specifics, then people who are impoverished are most directly affected by NCDs because they don't have access to the proper care and treatment that they need. We have a statistic here saying that 17 million NCD deaths occur before the age of 70 years old. And of these deaths, 86% are estimated to be in low and middle income countries. And again, just emphasizing what I said earlier, the reason of these deaths and why they're more prominent in impoverished people is because they don't have access to the treatment that they need to get better. And as a result, a lot of death and sickness happens.
So there are three main risk factors of NCDs, which are modifiable, metabolic, and environmental. So modifiable risks are basically things that you can change. They can be modified. They're like behaviors and what you're exposed to. Um, Metabolic is includes a lot of things relating to your metabolism, like blood sugar, waist circumference, blood pressure, cholesterol, and triglyceride levels. And then lastly, environmental risk factors are based on where you're living. It has lots of sub factors to it, like chemical, biological, and work related factors that can impact your health. So modifiable risk factors can help you prevent NCDs and manage NCDs. So, some ways to be healthier and prevent these include eating a balanced diet, which includes fruits, vegetables, whole grains, proteins, and healthy fats. And you should limit the consumption of processed foods and saturated fats and foods and drinks high in sugar. It's also important to engage in physical activities like walking, jogging, cycling, or any form of exercise. Um, I hope you guys aren't taking alcohol, but you should limit the use of alcohol, and as excessive drinking can cause major health problems. It's also important to, even if you're doing all these factors, it's important to visit your healthcare provider and your doctors for frequent checkups because this can help identify early health problems that can allow for fortunate intervention. And lastly, you should manage stress, and every person does that differently. So there's many different ways if you just search them up. Yeah. And if someone you know has an NCD, it's really important that you support them because they're going through a lot, and educating yourself is a great way that you can give them support and make sure that they persevere through it.
All right. So how do you diagnose NCDs if you may think you have one? So diagnostic tools are really important, especially in addressing a lot of CDs, which are communicable diseases like HIV, TB, and other diseases like sexually transmitted diseases. But for NCDs, since there are a lot of NCDs, there's a whole portfolio of diagnostic and monitoring tools that are required when you like first try to diagnose NCDs. So for the initial diagnosis of an individual, the diagnostic test, you need blood pressure and glucose levels, and they need to be addressed with the view of the overall risk of the individual for this disease. For example, like cancer and diabetes, which we will actually go into a little later. But yeah. So treating these diseases are a little different than diagnosing them. Diagnosing them is just seeing whether you have them or not with a like before yes or no answer. Treating them it's going to look different than treating an infection like an STI, but there's a lot of options for treating NCDs. Of course, some are really drastic, like chemotherapy and stuff for cancer, as well as insulin treatments for diabetes. So NCDs are really broad, and there are a lot of different ways to treat them. One thing that is very common is that treatment options are not going to lead to absolutely curing a non-communicable disease. The doctor may recommend lifestyle changes or medications that will improve your symptoms, but again, most of these diseases are chronic. So yeah, they'll probably last for a while. And these diseases are actually really, really expensive, and you want to make sure you know how to prevent them. Oh, right, sorry. So some common types of NCDs are cancer, heart disease, and diabetes, like I said before. These three are really, really prevalent, and they're three of the most important that we think that most people should know about. And so cancer, if you don't know already, is a disease that's the uncontrolled growth of abnormal cells in the body. Heart disease refers to a range of conditions that affect the heart, and diabetes is a disease due to high blood sugar levels in the body, which is usually managed by insulin. There's more on this in slides that are coming up, but yeah.
So cancer is a complex and serious health condition characterized by the abnormal growth of cells that can invade nearby tissues and spread to other parts of the body, potentially causing a range of symptoms, complications, and challenges in treatment and management. Cancer treatment can be very expensive, involving costs for various procedures such as chemotherapy, radiation therapy, surgery, medications, and other care, which can create a significant financial burden for patients and their families. And obviously, a lot of research is being done on this topic right now, but until we find like a more solid way to treat cancer, like preventing cancer is the most important thing.
As Aishwarya went into a little bit of a brief overview, heart disease is also one of the main and most common NCDs. Essentially, it's a disease that is when the heart is impaired and the function and the structure of the heart is impaired. An example of that being coronary heart disease, which is essentially when the arteries are obstructed, and the arteries are those that supply the blood to the heart muscle, which leads to heart attacks. There are not a lot of ways to prevent, per se, heart disease, but one of the biggest steps you can take is eating the proper diet, such as eating enough vegetables, fruits, grains, fats, limited fats, but all of this is very important to help prevent heart disease. Adding on to that, regular physical activity, 60 minutes a day, is essential for the heart. It keeps the heart healthy and strong, leading to your overall body being healthy and strong. Additionally, adding on to that, definitely it's very important to limit your intake of alcohol and tobacco, as those are major risk factors when it comes to heart disease. So all of these are just the basis to preventing heart disease, but one of the most important yet simple steps.